So some people will say, well, that's just a coincidence. I tend not to believe in coincidences, or at least to see them at face value, so that, in this case, I'm a dentist, I'm not a therapist. But it's through this experience that I developed the holographic laser treatment. So in order to share what's at the crux of this, I need to share first what I think was at the crux of Kathy's experience. If you remember, she was the one with the biomodulator, was just really freaked out. Well, in order to see this, I had to delve into the quantum science. And serendipitously enough, there's this article that came out actually in this month's Scientific American by this, he's a professor at Oxford, and what he's doing is he's showing how the quantum world, which is usually the world associated with small things, atoms, particles, molecules, waves, and how what he's saying is that the quantum effect is seen in the classical world, because in the physical world, in this world that we're in, physics is meant to explain it. In how the quantum effect is affected in the classical world, it's through this concept called entanglement. Entanglement is where you have two particles, molecules that are connected, but when they are separated, there's an energy that connects them. They could be totally on different ends of the universe, but if you interact with one, let's say, turn one molecule, the other part of that molecule will act in kind. So, there was a thought experiment back in the 1930s. A lot of stuff going on with Einstein and Niels Bohr, all these guys back there. Well, there was an Austrian physicist, Erwin Schrödinger, and there's a famous thought experiment called Schrödinger's cat. So it's preposterous on one hand, but on the other hand, Schrödinger meant this to actually be a joke, to make fun at the other school of thought at the time, the Copenhagen school of thought, but this preposterous entanglement theory still stands today. So how it goes is this. In a sealed steel box for, let's say, an hour, there's a radioactive atom in a vesicle. In a vessel, glass vessel. It's just big enough, there's just the right amount of atoms that in the quantum world, it reacts by being in what's called superposition. So it flips states. It has the potential for being in one state, and it also has the potential for being in another. Also in the Schrödinger's cat box is a cat, a Geiger counter, a hammer, and cyanide. So as it goes, in the quantum world, because the radioactive atom can both be decaying and not decaying at the same time, the decaying part is picked up by the Geiger counter, which in turn is attached to the hammer, which breaks the cyanide, which both kills and doesn't kill the cat. Because it's in a steel container, as it works in the quantum level, that if you were to peek in to observe, then that breaks the wave pattern, and then the cat will be either dead or alive. Or it could be the same if an individual looked at it, or it could be the same if there was an electronic device, because they've replicated this with all different types of experiments on the quantum level. So, what does a decaying atom have to do with decaying teeth? Well, my thought is that we, Kathy, Marta, myself, and you all, our subjective experience is like that Schrödinger's cat scenario. And what do I mean by that? Well, have you ever had an aha moment, right, where you think something is a certain way and all of a sudden, aha. An example would be, let's say, this father had a famous pea soup recipe that was handed down from generation to generation. He was very proud of it, and people have been telling him that his daughter hates his pea soup. And he said, nah, that funny face that she makes when she eats it is just because she's cute. But when they go to a paint store to pick a color for her bedroom, she says, Daddy, I don't want that color. She's 7 years old. Daddy, I don't want that paint color because it looks like your pea soup that And he gets it. It's the aha moment. So it's within this containment vessel that this waveform collapse. So as I coax people to kind of look at their own subjective state, it brings them to that more objective experience or state. So that could make sense if we're talking about Kathy and her need to stay within that fear talking scenario. That's just her way. But it doesn't really explain fully what happened in Marta's case. So I went a little bit further and I looked at he's a neuroscientist, Carl Pribram. Carl Pribram developed the holonomic brain theory, and he meant to explain how our memories are holograms. See, in our brain, we don't have a circuit that's fully connected to our grandmother. We could have a little piece in our eye about how she looked. We might have a piece in the in other sensory areas of her brain that connects to her. So when someone has brain cancer or a brain trauma, they don't lose their full memory. And that's because it's a hologram. These different areas, or it's a three-dimensional picture that's put onto a plate, and if that plate were to break, you don't lose the image, you might lose the resolution. So I think what had happened is that when I was treating Marta, she was able to move forward in her subjective, because of her interest, she was able to move forward, but because of the memory, and because this memory, unlike another model, which I wish I had time to share with you, doesn't have full consciousness. Our teeth may tell you if it hurts if you have a filling, but it won't tell you why. It won't tell you what the resolution might be. It's not consciousness in the brain. But it is cognitive enough, I feel, in the case of Marta, to be able to put this experience, to have this scenario play out. She's a smart individual. She's not going to go out of her way to have dentistry when it's painful. So I bring this experience and this example up really to show that when we're working on the holistic side of things, we need to be cognizant, because we're opening doors that we may not fully have the capacity to know and understand how to deal with. So that's why I use practitioners such as Douglas Economy, Dr. Nancy Erb, and others to help share and open up a dialogue. See, my goal is to have patients come to me and say, Doc, I know I need all this work. I just don't feel like I'm in a place where I can make the right decision or have the ability to be receptive to this care. So what's the takeaway? To be aware, to understand some of the dynamics that are at play, ability to accept treatment. So what that means for me is, if you hear something in treatment, when something's suggested, and gosh, I know I'm connecting